Welcome. I'm James Earl Jones. Today, addiction is the #1 health care and health cost problem in the United States. The importance of effective treatment and prevention has never been more important.
Each year, millions of adolescents struggle with issues pertaining to mental and behavioral health. Stemming from environmental, physical, and emotional insecurities, these issues manifest through a number of warning signs, including depression, anxiety, and in some cases, dependence on drugs and alcohol.
So many teenagers, females and males, are really self-conscious. They kind of doubt that they have abilities, or they really are just feeling insecure with their bodies.
They can be frustrating sometimes because they're projecting their frustration of the world out onto you. And if you understand that that's what's happening and you know how to deal with it effectively, you create a rapport, you create a relationship, you change attachment-based stuff, and you can start to impact the way that they maneuver in the world.
External motivators work great for a little bit, but I think internally sort of misses the mark. So if kids are just kind of quote unquote faking it to make it, it's not lasting. But what I like about our program is the internal motivators, that's going to follow them home. And if they can figure out how to make changes for themselves without being rewarded, other than possibly just feeling better, that's the ultimate internal motivator.
With the concept of punitive behavioral modification proving to be ineffective, a sea change is occurring in the treatment of the youth and teenage population when it pertains to mental health and chemical dependency.
The goal of treatment is to help young people take their emotional armor off. They're walking around with some cover in some way. And very often, unfortunately, most, I would say, treatment centers that deal with young people kind of require them to keep it on. And some of that's about who's providing the treatment, paraprofessionals versus clinical professionals and psychiatric professionals, and also who's in treatment with them. And that's a big one, that if you have a lot of conduct disordered people, if you have a lot of people that are acting out, you have to keep the emotional armor on just to be safe. It's why we have very, very rigorous exclusionary criteria.
I've worked at programs before where we have this one model and we're going to try to apply it to every client that we have, and that just doesn't work. You have a youth who's very introverted, experiencing a lot of depression, social anxiety. They might benefit more from CBT, mindfulness, cognitive therapy than a youth who is acting out and needs a more behavioral approach.
Located in multiple residential facilities off the Pacific Coast Highway, Paradigm is committed to achieving the best possible outcomes for individuals and their families. By focusing on empowerment and self-worth, Paradigm is providing a new look at life.
I think there's a lot of differences between us and other youth treatment centers. One of the big ones is that we're very, very transparent. We don't cut off communication. There's no blackout time. We want these families communicating, even if it's at the beginning when it's very rough and people haven't figured out what's going on for them and they're still in their old patterns. We step in and become a third party in it and start to impact that in a new way.
10 years ago, it was thought that something like major depressive disorder, if someone had that or received that diagnosis, then you had to disenroll from school and you were done. And what we have found through research is that with proper treatment, kids are often able to keep up academically with one-on-one instruction, certain tutoring, so that when they go back to school, they can integrate smoothly and they feel motivated and their self-esteem is building.
I think coming into treatment can be really difficult for families. There's a lot of guilt and shame around asking for help or recognizing like, hey, this isn't working. A lot of families, a lot of treatment want to figure out kind of where the problem started, where there's value in that. We're kind of more about living in the present and helping families identify their strengths and their needs and improving communication so that they can be on the same page and work to maybe resolve some of the old resentment that has just never been discussed.
The idea with our staff being around them so much and giving them some of that empowering kind of feedback to take care of their own lives and understand the impact they have on themselves and with other people, promotes something inside of them. It's not about doing something for me. It's about, this is your life, and how do you start to take control of it in some ways, because they have a lot of say. Even early on, they have a lot of control over how well or badly their mental health goes. And once they realize that they have some say over it, they start to utilize that power.
We're glad you could join us today. I'm James Earl Jones. See you next time.